Hey everyone, welcome back to Nova Pain and Rehab Center. So today we're going to do our third and final installment on fitness and movements for the equestrian athlete. So today we got some really good movements. These are difficult movements to do, to say the very least. If you're a perfectly healthy person with no issues, these are still going to be hard to do. I just wanted to give some really challenging movements to you to incorporate into your exercise routine. As with everything else we've done, these are fairly simple to use with very little equipment. You can do these at home. We're going to use some bands today and a ball, but they're fairly simple to do with very little expense. So just as a review of the last two videos, with almost every equestrian athlete, there's a few similarities that I always see. The biggest one is very, very tight muscles through here. These are called your adductors. And then weak muscles here, which are called your glute medius, your abductors. The reason for this is simply when you ride a horse, you're squeezing the horse. This is how you communicate and ride with the horse. And so these tend to be really tight, and these just seem to be pretty weak. And that imbalance creates a lot of the pelvic issues that we tend to work with the equestrian athlete. Also, as far as the upper back goes, I mean, just in general, people's posture tends to be very much in a forward or anterior position. This, of course, creates all kinds of problems when you're trying to sit up straight and maintain that shoulder position, especially if you're on the back of a horse for a couple hours or for a while. So these are some things we'll address today. Keep in mind that if any of these movements are painful or uncomfortable or just don't work for you, throw those off to the side, and then maybe they're not meant for you. And then we'll get into some things that we can talk about later, as far as maybe scheduling an appointment with us if you need to. Okay, so let's get into some anatomy first. Okay, so what we're going to do first is talk about this first movement. And so this movement, we're going to do a side plank with what we call an abducted leg extension. So the movements the muscles we're going to be looking at, a big one is this one right here called your quadratus lumborum. Now this muscle is a deep muscle, and it is a pelvic and spine stabilizer. This muscle is typically just weak on most people, and it's a very, very important muscle to strengthen when we look at both rotational and extension movements to the spine and back. The other movement we're going to get into is this muscle right here. It's called your Gluteus Medius, which is your main hip stability muscle. And as we said before, usually very weak on most equestrian athletes. Okay, so let's get into the movements with this. Okay, so first we're lay on the side. We got this is a side plank position. Let's go and get that up. Okay. So at the side plank, you may find that this in itself is going to be very difficult to do. You want to hold this usually for at least 45 seconds to a minute. If you can do that, then what we want to do is get into the second part of this, which is extending the leg up. And this is going to be hard to do. This is going to incorporate both your quadratus lumborum and your glute medius muscle all at the same time. Even for a very healthy, strong person, this can be a challenging movement to do. But as a combination movement, it's just, I don't think it gets any better as far as strengthening these two muscles together. This is a very important exercise to do for an equestrian athlete. Okay, when you get to the top, you can hold the position for usually 3 to 5 seconds, get that leg up, another 2 to 3 if you can do it. Come down, relax. This is an exercise, so you're not holding the position like you would a straight plank. And just do it until you just can't do it anymore, and then you're about done. So, and also make sure you do this on both sides bilaterally. Flip over, come up. Good. Okay, so let's get into the next movement. So the next movement we're going to do is going to engage a number of muscles. It's really going to hit the hamstrings. Now you have 4 different muscles that make up the hamstrings. You have a lot of these long, thin muscles through here. This is also going to really get into the erector muscles, so these erector muscles of the back, and actually it's going to isolate the glute maximus muscles. So you got a lot of different muscles, and this is a difficult movement we're about to do. So let's get into it. So what we're going to do, the first movement, we're lying down, we got a ball underneath this, and so this is an active movement. The first step one is you want to bridge up on the ball, take that up, and then pull the ball back. You're going to feel this through your hamstrings, and your back, and your hips, and your glutes. Okay, again, this is a difficult movement to do, but if you can do this, you're combining a lot of different muscles and movements together in one exercise. And so when you come up, she's bridging up, she's holding that. Now the movement here is you're pulling the ball in and pulling it back. And so once you get to the point where you're completely fatigued, you can drop the butt down, Relax a little bit, shake that off, come on back up again, try it again. If you get to the point where you can only do 2 or 3 of these, and you're probably just about done. Okay, so the key with this is you need to hold that bridge position up for at least a minute if you're going to pull that ball back. If you can't hold that bridge position up or you start to feel pain in your back, the second part may not be the best movement for you. Okay, all right, excellent. So let's move up to the upper back. So let's come up to the upper back a little bit. This next movement we're going to do in rehab we call a D1 or D2. So it's a diagonal movement working the back or the posterior spine muscles. The primary muscles this is going to engage is the rhomboids, which attach from the shoulder blade to the spine, the serratus posterior superior, which is another very important in upper shoulder blade, we call scapular stability, and then also this muscle here, which is one of your rotator cuff muscles called your infraspinatus. Okay? Okay, so first movement we're doing, take that up a little bit. So we have, again, this is called diagonal because we are moving this on a diagonal line. So this is going to work, we call a D1. So we're going to take the band and pull it across. You're pulling down on the band. Almost like you're trying to, how do we say this? You're trying to pull, one's the sword, the other is the seatbelt. Trying to pull the seatbelt down. Yeah, so you're trying to pull the seatbelt over the front of you. Good. Now you're going to feel this start to burn pretty quickly. You want to work this as much as you can. If you want to do 2 sets of it, that's great, but ultimately you want to do this as many times as you can until that muscle is completely fatigued. As with most stability movements, you want to do this bilaterally or on both sides. Okay, so let's go to the D1, or I'm sorry, D2 movement. So this is what we call the sword. So imagine you're pulling a sword out of the scabbard. There we go, pull it up. So now we're going on a different line, a different diagonal line, isolating a different muscle group in the back. And it's important that you really try to keep those shoulder blades back, retract your shoulder blades as you go through the movements. Okay, work until you completely fatigue the muscle. Work maybe twice if you can do it on both sides, and then you are done. Okay, excellent. Okay, so for the last movement, this is going to be a fun movement to do. So this is working more of the mid-central muscles of the back. We're going to get into, it's a plank variation. So if you've ever done any core stability work before, you know what the plank movement is. We're just going to add a little spice to it. Okay, so let's get into that plank position. Okay, there we go. Okay, so we're going to maintain the plank position. Now, this plank, you should be able to hold this for at least 90 seconds before you get into this movement. If you can't do this for 90 seconds, you need to practice that before you get into the second part of this position. So now we're going to do shoulder taps. Back and forth. Okay, you want to do 10 on each side. And then come back into that plank position. Hold that for 10 seconds. And then you're going to do another 10. The goal with this is one time, as many as you can. Okay, you'll start, everyone's going to fatigue at this, in this movement at a different place. Once you get to the point where you just can't hold yourself up, then you are done. And as you see with her, she's pretty strong through a core, so this may take her a while to do. But no doubt you will know you've gotten a good core movement when you've completed this. Okay? All right, excellent, thank you. Okay. All right, so in conclusion, an equestrian athlete is a very specific type of athlete, just like any other sport, and they do require certain elements, both in training and rehab, that's different from other athletes. If you are having some problems, you feel like your riding capability is not quite there, you just want to check us out and see what we can do for you. Give us a call and see what we can do. A lot of times the problem may not be as difficult as you think to fix. As with all of our clinics, we have a full rehabilitation center. We offer chiropractic, physical therapy, and in our Arlington location, we do offer medical services as well. You can call us at our Arlington location at 703-535-8887, and then our Purcellville number is 703-376-3797. Hope everyone has a great day, and look forward to getting back out on the back outside again. Thank you.